Hi, thank you, Dr. Betkar. Thank you so much for having me. And I would be happy today to share some knowledge about sleep and some tips how you can get a better sleep so that will improve your general well-being and help you to be successful in your career. Just a few words about my background. So by the background, I'm a neuroscientist and been studying sleep for last 15 years. And since that, I started my own sleep consultancy where I help people to get better sleep without like medications and improve their well-being in general. So unfortunately, today we really are in the middle of the pandemic of like poor sleep and sleep deprivation in our world in many countries, and that's due to many reasons. And I'm sure that signs of having not enough sleep are very like common and very familiar to each of you. And there, I just would name a few, and they could be like feeling just exhausted and tired during the day, which is obvious. But for example, being a bit irritable, aggressive, or overreactive to small problems or situations, this also quite common signs of having poor sleep. Also having like increased emotional sensitivity and difficulty in making decisions, forgetting the things all the time, or craving unhealthy foods, for example. These are all also signs of having not enough sleep or having poor quality sleep. And unfortunately, according to the global statistics, now about 30% of population in the world get a bit less than 7 hours of sleep per night. And according to the World Health Organization, the amount of sleep that we need to get every night is actually about 8 hours of sleep. It varies between 7 to 9 hours of sleep, but and most of us need on average 8 hours of sleep to perform good. And so 30% of the people get less than 7 hours of sleep, and 1 in 3 people in the world suffer from poor quality of sleep, and 10% of the population diagnosed with some sleep disorders. And most vulnerable populations are actually women, older people, and teenagers. This is the groups which are at risk of having poor quality sleep. So you would ask me, why having like good quality sleep is important? Besides those obvious things that I just named in the beginning, like having like proper good mood, emotional condition and health, there are also research says to us that there are also health problems that are caused by poor sleep or lack of sleep. For example, we know that people who don't get enough sleep or less than 7 hours of sleep per night, they have increased risk of having high blood pressure, and they have increased risk of having heart attacks and strokes. And those people that have 5 hours of sleep per night or less than 5 hours, they have a 45% greater risk of having heart attack or stroke than any other average person. So it doubles your risk, basically. Then also people who have worse sleep, they have high probability of having depression and anxiety disorders. We know that 75% of people who have sleep issues will develop depression in the end. We also know that people who sleep not enough hours per night have high risk of cancers, of any type of cancers, like breast cancer, colon cancer, ovary cancer. So it's very global thing which affects every aspect of our health. So having enough amount and enough and proper quality of sleep is very important. And just to give you some overview, very general overview, what happens with us when we go to sleep. So unfortunately, like for basically very, very long time, people thought that we go to sleep and it's basically inactive process, nothing important happens, so this is not so important for us. But fortunately, for the last 50, 60 years, the progress and the science went so far to really show us that it's so important, and really show us what is happening with us during sleep every night. So in a very brief and very generalized kind of terms, it would be to explain like this. When we just fall asleep, we go straight to the very deep stages of the sleep, where basically we recover all our physical body. So we recover our muscles. For the kids, for example, during these deep stages of the sleep in the beginning of the night, they are growing in these stages. Actually, we adults, we don't grow, of course, but we still produce the same type of hormones that facilitate all the recovery and repairing processes in our body. So all the damages that happens to us during the day just gets eliminated during these first stages, deep stages of the sleep in the night. And this like first half of the night, basically first 3-4 hours of the sleep. Then later we go to the a bit lighter stages of sleep, which is called so-called like REM sleep. It's dreaming stages of the sleep, where most of us have a lot of dreams. Actually, we are dreaming through all of the night, but at this second part of the night, these dreams are really vivid, and we really like remember them so nice, so vividly. So that's why it's called dreaming stage of the sleep. And this stage is important for us because we recover and repair our emotional state, and basically all kind of mood regulation, emotional processing, memory learning, problem solving, all these things happening during the second part of the night. And so, for example, I give you an example. If you, for example, need to catch up early flight in the morning, and you intentionally deprive yourself from the last 2 hours of sleep because you need to get up early and go to catch up the flight. So you in theory deprive yourself from 25% of sleep, but in practice you deprive yourself from 50% of this dreaming stage of sleep, because this happens mostly during the second part of the night. So that's why during this day probably you will have like very irritable mood and be very aggressive, and maybe not solving problems so good, and maybe not memorize things so well, just because this part of the sleep was affected during that day. So it's very important to have the duration of sleep to stick to these 8 hours and getting enough of this opportunity to sleep. And if you ask me, okay, what can I do then in practice to get better quality sleep? And the answer might surprise you, because I usually tell to people that the good night's sleep actually starts in the morning. Why it's in the morning? Because in the morning, when we wake up, there are a certain amount of hormones released in our body, like wake-up hormones, such as cortisol. It's not like a stress hormone, although in the morning it doesn't have its negative effect. It's an opposite, like energizing to us. So when we wake up in the morning, it's so important to keep this wake up time quite regular. Because if you train your body to wake up all the time at the same time, you basically every day will build up the same amount of sleep pressure during the day. So it's more likely that you will go to the bed at the same time as well. So waking up in the morning at the same time is really good habit to have a good quality sleep. The next thing is actually what can affect your sleep quality is how you spend your first hour during the day when you wake up. What do you do actually? So if you exposing yourself, there are a lot of research now popping up in this kind of topic, and I'm sure that many of you probably aware of that. So if we expose ourselves to the natural light in the morning, it's very beneficial for our circadian clock, like our biological clock, and our sleep quality, because basically having this natural sunlight into our eyes helps us to decrease the amount of the sleeping hormone melatonin in the blood and deposit for the later moment, for the night basically, and also helps us to like inline our body clock with the outside external cues. So having morning sunlight for just even 2-3 minutes, if it's sunny day, can make a huge difference for your sleep quality later. If it's cloudy day, then it's better like to increase this time and having up to 20 minutes if it's really overcasted day. But having this morning light is very important. And another thing is that having some morning routine is also very beneficial, because we know that when we wake up, our brain is actually in the particular brainwave activity, which is a bit slower than oscillations during the day in the brain. So our brain, if we would describe in simple words, is a bit more receptive to all the environmental stimuli. So for example, if you in the morning wake up and immediately like grab your phone to check your emails and like check the social media or check the news, you immediately, your brain is so receptive to this information that it just gets overwhelmed by all this information. And basically you set a not so good tone for the day. But if you focus just even the first half an hour on some relaxing activities and routine that repeats every day the same, without involving any kind of a blue light from your devices and any overstimulation, then it can really set a nice tone for the day and improve your sleep quality at night, it's shown. So this is kind of morning practices, what you can do to improve your sleep for your general well-being. And what are the evening practices? So again, it shows that watching sunset is very beneficial, because there are particular wavelengths that through our retina, through the eyes, affect our brain and help to set the circadian clock and basically show to our body that it's a time to go to sleep. And so if you have an opportunity to watch a sunset or being exposed to the natural sunlight waves during the sunset, this can be beneficial. Then, as I said before, like sticking to the regular routine is important. So as you wake up in the regular time, so going to bed at the regular time is so important, because our body learns to from the rhythm that we set, and aligns all the hormonal changes in the body according to this rhythm. Another thing is giving yourself opportunity of having 8 hours of sleep. So for example, if you are going, you know that you need to wake up to work at 6 a.m. You really need to go to bed at 10 p.m., like giving that opportunity to have yourself 8 hours of sleep. It's very important of having an opportunity. So trying to be very mindful about that. I know many people actually put alarms, not for the morning, but they put alarms in the evening, so to signal them that it's a time to go to bed. This is a nice, could be practice. And then having some relaxing, again, activities without involving your digital devices without involving blue lights, because we know that the blue light is very much a big disruptor for our circadian clock. So no phones, no laptops, and no work desirably like 1 hour before going to bed. It's very important. If you can dedicate to some relaxation techniques like meditation or breath work or whatever is working for you, maybe, spending family time or reading a book, it can be really beneficial. Another thing is very important is remember about the sleep environment. The best sleep environment, according to the World Health Organization, is actually to keep your bedroom quite cool. So trying to keep it, I know sometimes it's hard, but trying to keep it between like 18 to 20 degrees Celsius is nice. Having also, keeping it very dark, it's very important. And for that, using like blackout curtains or using a sleep mask if you don't have possibility to have a blackout curtains, because darkness helps with the production of the sleeping hormone melatonin, which in turn really helps to make the sleep consistent. Then if you having like noise in the night, it's shown that even low-grade noise from outside can disturb our sleep a lot and put us in the more superficial stages of the sleep. So if you know that you live in the noisy area, having some white noise machines that can block out this noise, it's shown in the research very beneficial for that. Also, of course, your sleeping environment should be comfortable. It should be comfortable pillow, comfortable mattress, and trying to keep your bedroom also as less cluttered as possible, because again, there are beautiful researchers showing that when we keep a lot of our things in the bedroom, it increases our cortisol level, stress hormone, which hinders like sleep process. So like for the good sleep practices, it's like to keep your bedroom only for sleeping and trying to avoid keeping there any work-related stuff or maybe like clothing or other things. And there are few things that you for sure should avoid for having a good night's sleep. This one thing is that caffeine. We know all that caffeine affects sleep, but not many people are aware though that, for example, the half-life of caffeine is 5 hours. So meaning that if you took a cup of coffee at 12 p.m. in afternoon, at 5 p.m. you will still have half amount of that caffeine in your blood, which will impact your sleep quality. And so by 10 p.m. when you go to sleep, it probably will already dissipate. So the latest time I usually suggest to my clients to have caffeine is really 12 p.m., not after that, because everything which we take in the afternoon will affect the sleep quality. The same thing goes for the alcohol. Alcohol is the biggest disruptor of sleep quality. And many people think that I drink alcohol, it helps me to sleep, it helps me to fall asleep, which is actually shown that it's doesn't put the person to sleep. It puts person in some kind of an anesthetized state, which is absolutely different from the sleep state. There are not these recovering processes happening. And trying to avoid drinking alcohol, like let's say 6 hours before going to bed, is really beneficial. So if you have a glass of wine, have it sometime in the early afternoon, not before going to bed. Also, napping is like very arguable topic. Some people like to nap. If you like to nap and you think that it gives you a boost of the cognitive performance, you can nap, but maybe try to nap not later than 1 p.m. because usually after 1 p.m. it affects the sleep quality and it's harder to fall asleep. So, and having this nap shorter, like on the shorter side, like 20 minutes is the optimal, it's shown. And also trying to avoid any heavy sugary food before going to bed is really important, because we know that if we consume some heavy meal with a lot of sugar, let's say like 1-2 hours before going to bed, we will have a lot of glucose spikes that coming afterwards. And usually people who tend to eat a lot of sugary foods before going to bed, they usually wake up around 12, about midnight. And they really don't understand why they wake up. Like, there's no reason for that. But the reason is just because after the dinner, the sugar spikes went so up, and then they go so down on the slope down, and that wakes us up because our brain mostly runs on the glucose, and when brain senses that there is significant drop in the glucose, it just wakes us up, and it can create a lot of night awakenings. Another thing is that having a good exercise routine really can improve your sleep quality, but if you exercise too close to the bedtime, it also can impact it not in the best way. So trying to exercise during the first part of the day is very important. And what I say is also trying to follow the natural rhythm of the environment that we are living in. Basically, with the sunrise, we put all our lights on and we go outside, we get that sun. After the sun goes down, I would advise you to dim the lights also in the house, so that you are preparing, you have like few hours where the lights are dimmed and your body knows that, okay, it was the sunset and it's time to go to bed soon. This is very important practice that you can do. And I guess this was mostly all the tips general tips that would help to have a good quality sleep. And I would probably share one bonus technique which I love, and I share with some people who in business usually, and they very stressed out, and they sometimes don't get enough quality of sleep and enough opportunity to sleep. So we know from the research, from the beautiful research that is coming more and more nowadays, that having a regular breath work and meditation can help with the quality sleep. And especially we know that there is such a practice deep relaxation techniques, they are called non-sleep deep rest techniques, which helps us to put in the similar bit state as a sleep. Although we cannot mimic sleep. Sleep is a unique process in our body which we cannot mimic with anything. But still, these deep relaxation techniques, doing them regularly, every day for 20 minutes, when you are in this kind of stressed period of your life, can also improve. It's shown that it can improve the sleep quality and can balance the neurochemical levels in the brain that in turn help with the mood and the sleep. So look at those techniques if you feeling that you are sleep deprived, if you would like to improve your sleep quality in a fast way, that could be also an option. I guess this is all what I wanted to share, some tips. So I would be happy if you have any questions, please let me know. Question, can you please repeat it? Which light? Yes. I would be careful a bit of having some plants. There are a few plants Salsivia, for example, those are quite common to have in the bedroom, and it could be beneficial because they produce oxygen in the evening, in the darkness also. So they can help to clean up the air in the bedroom, and they can be used in the bedroom actually. And there are only a few plants of this, like one of them that I remember is Salsivia. But with others, I would be very careful because most of the plants, they take the oxygen in during the darkness. So it's actually not so beneficial for having them in the bedroom in this case. But some of them can be beneficial.
Good evening, Dr. Bedkar sir, and good evening, ma'am. I think it is a 6:15 at your place. A wonderful presentation you have made, and sleep is one of the very important relaxation, physiological mechanism in the human body. So we rest and we make our system, at a normal level. So sleep is very much required for every human being. Yeah, I'm from the medical field, and I face so many patients are coming with sleeplessness different sleeplessness patterns also, especially the adults. And the basic reason is the anxiety and the stress what they are having, financial tensions what they are having, they are coming with. And some people are coming with no reason, they don't get sleep. So these are the two reasons, but we can understand the reason, if there's a sleeplessness, some reason. But why there is a sleeplessness without any kind of reason as such? That is the first question. And second question is, the sleep during the daytime, and is there any difference? Which sleep should be considered as a important sleep for the human mind and human body? Thank you.
Thank you for your question. The second question I probably didn't. It got interrupted a bit. For the first question, so yes, definitely there are people that you can see clearly the reason why they don't have enough sleep, and it could be like you mentioned, anxiety, financial strength, and so on. For those people who have no clear reasons why they would have a poor sleep quality, what I would do first, I would analyze their routines and see maybe there is something during the day that they still do, because many people unintentionally do something which affects their sleep quality. Like I said, nutrition is the first thing to look at, although it seems that it's not so much connected. But what and when they consume can a lot affect how many times they wake up in the night, or do they have troubles to fall asleep. This is one thing. So I would look holistically what is there could be some from their fitness nutrition perspective and daytime activity. And another thing is that those people could also be having circadian disorders. So maybe those timings of the sleep are not appropriately aligned with their natural circadian body clock that they have. So again, analyzing their routines and seeing what is the most appropriate time maybe for sleeping to them could have some insight on how to deal with this. I guess there's things that come to my mind. And regarding your second question, you ask what type of sleep is more beneficial for us, day sleep or night sleep. That's what the question was. So we know, of course, that in the night, as I said, during the first few hours of the night, this is the most probably recovering sleep that we have. It's the deepest sleep and the most recovering sleep. So having it uninterrupted is very important. And that comes, for example, when people have interrupted sleep. For example, the best example is when we have small children and they wake up constantly, every hour, and they wake up parents every hour, for example, and they don't get this consistent at least 3 hours of sleep in the beginning of the night. We see tremendous drop in all the health parameters, because we know that this having chunk of like 3-4 hours of consistent deep sleep in the beginning of the night is very important, kind of a necessary part, I would say. But in general, I wouldn't like separate what sleep is more important for us. As I said, like every stage of sleep does its own thing, and it's very important. And day sleep, it's not necessary. I mean, we now evolved in humanity, which we are monophasic. We became monophasic. We before were polyphasic. But if you feel that it gives you benefits and it, for some people, really boosts cognitive performance, so then it's probably beneficial for you, like having a small nap.
Yeah, thank you. The lifestyle, people are having their mobile cell phones in their hands, and they are sleeping late in the night, maybe 1 o'clock, 2 o'clock, and they are getting up, very late in the morning time. So that is also one pattern has changed nowadays. And what I'm recommending to my patients are, what I ask them, usually patient try to sleep early in the bed, but again, it will not induce a sleep. But what earlier, maybe early by 5:30, 6 o'clock. So that will saturate sleep on your eyes, much before than the time. So that is what the technique I'm using, whether it's correct or what you think about this. And in India, we are having, we are using a very ancient technique for sleeplessness is, we call it as a Shatapauli, means 100 steps. So we have to walk 100 steps before going to the sleep, and that induces. That is how people are doing it from the past. So what do you think about this? Thank you.
Yeah. So about the second technique, because that's a hard, well, the first one not so well. So there is a really wise technique. I guess this wisdom came with the years, and having you walk before going to sleep, it really improves the quality of sleep because you are getting outside, you're getting fresh air, and you're moving your body. And this activity is not in the kind of high intensity activity, which high intensity activity is actually exercise activity, can disrupt sleep. Walking is really in this moderate intensity activity, which is perfect for improving the sleep. So this is a wisdom which comes, with you in India. Regarding the first technique, I'm sorry, there was some interruption. I couldn't hear you.
Thank you. Thank you very much, ma'am. Wonderful explanation. A very thought-evoking session we are having.
Yeah, thank you. Thank you so much for having me. Thank you. Yeah. Bye.
Bye bye. Thank you.